Okay, so you've definitely heard of it. You've probably even heard its famous nickname. But do you know how Tadalafil really works? Well, we're about to break down the actual science behind this super well-known medication.
Yeah, its big nickname is the weekend pill. But why? What does that even mean? That's the big question we're going to answer. And in the process, we're going to dive deep into the chemistry of how it all goes down inside your body.
All right, first things first. What is Tadalafil really? Let's get the official stuff out of the way. So, Tadalafil is part of a drug class called PDE5 inhibitors. I know that sounds super technical, right? But its whole job is actually pretty simple. It's all about increasing blood flow. And here's the really important part. It's not a free-for-all. It's designed to send that blood flow to very specific places. Okay, to get how Tadalafil works, you first have to understand how your own body works. It's kind of like there's a biological on and off switch that's in charge of blood flow. So let's talk about the on switch. Naturally, it starts with sexual stimulation. That triggers the release of a chemical, nitric oxide. Think of nitric oxide as the starter pistol. It then activates something called CGMP, which is basically the go signal. And when that go signal is on, it tells the blood vessels to just relax and widen. And boom, that's when blood can rush in. But you know, what goes up must come down. The body needs a way to turn things off. And that's where the off switch comes in. It's an enzyme called PDE5. And this little guy has one job and one job only, to hunt down that go signal, CGMP, and break it apart. Once it does that, the blood vessels go back to their normal state, and the process is over. This is where Tadalafil steps in. It's so simple, but so clever. It doesn't touch the on switch at all. Instead, it gets in the way of the off switch. It basically blocks that PDE5 enzyme from doing its job, which means the go signal sticks around for a lot longer. And right there, that's the number one myth we need to bust. Tadalafil does not magically create an erection out of thin air. You absolutely still need that initial spark, sexual stimulation, to get the whole process started. All Tadalafil does is help the body's natural response last longer and be more effective by keeping that go signal from fading away. What's really wild is that this one simple trick, just blocking that off switch, can be used for more than just one thing. It's surprisingly versatile and helps treat a few totally different conditions. Okay, use number one, the one everyone knows, erectile dysfunction, or ED. Pretty straightforward. By keeping those blood vessels open when there's stimulation, it just helps achieve and maintain an erection. But then there's use number two, which might surprise you. Benign prostatic hyperplasia, or BPH, basically an enlarged prostate. Here it works by relaxing muscles in the prostate and bladder. That eases the pressure and helps relieve those really annoying urinary symptoms like a weak stream or having to go all the time. And this is what makes Tadalafil really stand out. A lot of men deal with BPH and ED around the same time in their lives. So Tadalafil is uniquely approved to tackle the symptoms of both at the same time, with just one pill a day. It's a real 2-for-1. And believe it or not, there's a third major use for a really serious condition called pulmonary arterial hypertension. Now for this, it's sold under a different name, Adcirca. But the science is exactly the same. It widens blood vessels. Only this time, it's doing it in the lungs to bring down dangerously high blood pressure. So with all these different jobs it can do, it totally makes sense that you can take it in different ways, right? It really just depends on your lifestyle and what you need it for. For ED, you basically have two main choices. There's the on-demand way, which is a bigger dose you take, say 30 minutes or so before you think you'll need it. Then there's the once-daily option. That's a much smaller dose you take every single day, so you're always ready to go, no planning required. And this is it. This is the answer to the big question from the beginning. Why the weekend pill? Because a single on-demand dose can work for up to 36 hours. Think about that. That's a day and a half. That massive window of opportunity is what makes it so different from everything else out there. All right, we've talked about how it works and what it's used for. But now we need to get serious for a minute and talk about maybe the most important part of this whole thing, the safety stuff. The risks, the warnings, this is the fine print you absolutely have to know. Okay, listen up, because if you only remember one thing, make it this. You must never, and I mean never, take Tadalafil with any kind of nitrate medication. These are drugs like nitroglycerin that people sometimes take for chest pain. Taking them together can cause your blood pressure to drop dangerously, even fatally. This is non-negotiable. Of course, like any drug, there can be side effects. The common ones kind of make sense when you think about it. Headaches, getting flushed, back pain, it's all related to those blood vessels widening. But there are also some very rare but very serious side effects. We're talking about things like an erection that won't go away for more than 4 hours, or a sudden loss of vision or hearing. If any of that happens, it's a medical emergency. You need to get help right away. And it's not just nitrates you have to worry about. You also need to be careful with other blood pressure meds, like alpha blockers. Drinking too much alcohol can make you dizzy. And this one's weird but true. Even grapefruit juice can mess with how your body handles the drug, which could make side effects worse. So when you put Tadalafil head-to-head with its biggest competitor, sildenafil, Viagra, what's the difference? It really boils down to 3 key things. First, that super long duration, up to 36 hours versus just 4 to 6. Second, food doesn't really affect it, whereas a big fatty meal can slow Viagra down. And third, it's the only one approved for that daily 1-2 punch against both ED and BPH. So, there you have it. Tadalafil is this really powerful, really versatile medication that all comes down to blocking a natural off switch. But with that power comes some pretty serious risks. So, the big takeaway question, is it right for you? Well, that's not for me to say. That is 100% a conversation you need to have with your doctor to see if it's a safe and smart choice for your situation.